Hello, everyone, and welcome to Triage Cancer's webinar on prescription drugs. My name is Madison McMahon Ward, and I'm the program coordinator for Triage Cancer, and I will be moderating today's webinar. Now, before we dive into our topic, I need to go over some housekeeping. All callers will be muted for the webinar. If you have technical problems, please type them in the chat box. This webinar is being recorded and will be available for viewing by the end of the week at triagecancer.org. If you are calling in from a phone and are not logged on to a computer, you may receive an email saying that you did not attend. If you get this email, please reply with the phone number you used to join the webinar. After today's session, you will be prompted to take the evaluation, and you will also receive an email tomorrow with an evaluation link. We would appreciate it if you could take a few moments to provide your feedback. We are very grateful to Pharmacyclics, Janssen, Seattle Genetics, Novartis, and Takeda Oncology for sponsoring the 2020 Triage Cancer webinar series. If you have any questions for our speaker, please type them in the Q&A box found either at the bottom or the top of your screen. Our speaker will only see questions posed in the Q&A box. If you are experiencing any technical issues, please use the chat box to let us know and we will try to assist you. Please do not use the chat box to ask questions for our speakers or to talk with other attendees. The slides from this webinar will not be distributed as they are not meant to be a standalone resource. The content can change frequently, so we don't want potentially outdated information to be shared. The resources mentioned during this presentation are available on triagecancer.org and cancerfinances.org. We encourage you to share our resources with your community, but we ask that you cite Triage Cancer as a resource. As part of the accreditation process for healthcare professionals, we have to read the following information. This presentation is intended to provide general information on the topics presented. It is provided with the understanding that the author is not engaged in rendering any legal, medical, or professional services. The planners and presenters for this program have not disclosed any pertinent financial relationships or conflicts of interest. While this educational program has received commercial support from the previously listed sponsors, the content of the program has no relation to the commercial interests of the organization's products or services. Triage Cancer is an accredited provider of continuing nursing education by the American Nurses Credentialing Center's Commission on Accreditation. Triage Cancer is also approved to offer social work continuing education by the Association of Social Work Boards approved continuing education program. Therefore, nurses and social workers participating in the live webinar and meeting the following requirements may be eligible for 1 continuing education credit or contact hour. In order to receive continuing education credit, you must have registered online for today's session. People who are listening in on someone else's computer are not eligible for credit. You must attend the entire webinar. Partial credit will not be given. Anyone watching a recording of this webinar is also not eligible for credit. Within 1 week of this webinar, complete the evaluation and post-test. You must receive a passing grade on the post-test for credit. After the webinar, you will be redirected to the evaluation and post-test. Please note that on the evaluation, it asks for your name and email address. You must include these so that we can certify that you completed the evaluation. That email is the address we will use to send you the certificate, and we will send out certificates within 4 weeks. For other professionals, we are more than happy to provide a general certificate of attendance. Just indicate that on your evaluation. And if you have any questions or experience any problems, email us at info@triagecancer.org. So with that housekeeping out of the way, Triage Cancer is a national nonprofit organization that provides education on the legal and practical issues that may impact individuals diagnosed with cancer and their caregivers. And I'm going to spend a few minutes sharing some resources with you so that you know where to go for more information or where you can send others. We provide education in a few different ways. We participate in events all over the country. Some of these events are hosted by our cancer community partners, and some we host ourselves. To see where we will be, take a look at our events calendar. Every year, we host 3 free Triage Cancer conferences. This day-long event covers a variety of topics for individuals diagnosed with cancer, caregivers, advocates, and healthcare professionals. In 2020, we will be hosting 1 conference virtually, and we plan to be in Chicago on October 10th. Registration is open. We also host a monthly webinar series open to everyone. If you weren't able to join us for one of our past webinars, or you would like to hear the information again, remember that we post the webinar recordings on our website. We also host 2 educational programs for healthcare professionals. The first is our Insurance and Finance Intensive. This is a full-day certificate program on health and disability insurance and finances. We also have a full-day training on employment called Navigating Cancer, Work and Insurance that we deliver with Cancer and Careers. You can get more information and register for these programs on our website under the Events tab. We also offer the Triage Cancer Advocate training to train people who are interested in getting more involved in cancer advocacy efforts. The next training will take place on October 9th in Chicago. We have reopened the application and are accepting applications until July 31st. In addition to our events, we offer educational materials and resources. Our quick guides and checklists are designed to be a snapshot of a particular topic, and they cover a variety of topics, and we are frequently adding new ones. These materials can be downloaded from our website, or you may order bulk hard copy materials at triagecancer.org/material request, and we will ship them to you for free. We know it's hard to find information on the internet, so we have compiled the contact information for some of the most frequently used state-specific agencies and resources. And because where you live can impact what protections you have access to, we have charts of state laws on employment, disability, health insurance, estate planning, and more. We recognize that everyone learns in different ways, so we also provide educational animated videos on topics such as health insurance, managing side effects at work, and more. Videos are available in English and Spanish, and stay tuned as we have more videos coming soon. In fact, our newest video is on supporting caregivers, which covers some of the legal protections and programs available to caregivers. You can find all of our videos on triagecancer.org. We also offer most of our quick guides and all of our animated videos in Spanish. Cancerfinances.org is a site that we host to provide practical information on topics that can impact your finances. The website is designed to guide you to the information that is most relevant to your situation and connect you to financial assistance resources. We have modules on health, disability, and life insurance, education rights, estate planning, family building, caregiving, clinical trials, and a new COVID-19 module. Stay tuned for new topics. Triage Cancer and Citizen are partnering to give cancer patients an easy way to organize their complete health history, free of charge. Citizen is a free online resource that helps cancer patients quickly and easily request their full medical records from all of their providers. It's really easy to sign up at citizen.com/triagecancer. And finally, our educational blog not only provides great information about cancer survivorship topics, but because things are constantly changing in the cancer community, this is how we share late-breaking news. And we have our monthly e-newsletter, which is where we announce all of our upcoming events and new resources. So with no further ado, let me introduce today's speaker, Monica Bryant. Monica Bryant is a cancer rights attorney, speaker, and author, dedicated to improving access to and availability of quality information on cancer survivorship issues. Monica is the co-founder and chief operating officer for Triage Cancer. Throughout her career, Monica has provided hundreds of educational seminars, written articles, blogs, and co-authored a book published by the American Bar Association called Cancer Rights Law, an Interdisciplinary Approach. Remember, if you have any questions, please type them in the question box so Monica can see them and answer them towards the end of her presentation. So with that, I'd like to turn it over to Monica.
Thanks so much, Madison. So I'm delighted to be here today to talk to you all about prescription drugs. But before we can get into the heart of that topic, we have to kind of step back and appreciate the fact that there is a general lack of understanding around the healthcare system in the United States and certainly around health insurance. And we have lots of both anecdotal and quantitative data to back that up. So I want to start off today's session going over some terms and just to make sure that we're all on the same page, because something as quote unquote basic as having an understanding of the terms that are being used in a health insurance policy can make a really significant impact. So these are terms that are often used but frequently misunderstood. So around the costs related to health insurance, when we talk about a premium, that's the amount that you're going to pay monthly just to have health insurance. And you're going to pay this whether you go to the doctor or not. Now, most of us in this country are going to be accessing prescription drugs with the help of some type of health insurance policy. So in addition to the premium, what else are we potentially going to be paying for? Well, there are some extra costs that you're going to incur when you actually go to use that insurance policy. So your deductible is the amount that you have to pay before your health insurance company even starts to pay any portion of your care or your prescription drug costs. So you have to pay that first before the insurance company picks up their share. Their share is referred to as co-insurance or cost share. So two different terms for exactly the same thing. Now the deductible is going to be a fixed dollar amount that you have to pay each year. And once you reach that amount, the insurance company starts kicking in their share of the cost. The cost share is actually going to be a percentage, and you pay that each time you get care. So if you have a plan with a cost share of 80-20, that means that once you've met your deductible, the health insurance company is responsible for paying 80% of your costs, and you're responsible for paying 20% of your costs. Now, many plans also have a copayment. And again, that's going to be a fixed dollar amount, and you're going to pay that each time you get care or each time you get your prescription medication. And the amount is going to vary plan to plan. So some plans have a $10 copayment for prescription drugs. Some have a $25 copayment. It could also vary depending on the type of prescription drug you're picking up. So we'll get there in just a minute. Now, when we talk about your out-of-pocket maximum, that's the most that you're going to pay for your health care during the year. And the way that you get to your out-of-pocket maximum is by adding up everything you've paid towards your deductible, everything that you've paid towards your co-payments, and everything that you've paid to your co-insurance. So it's everything that you're paying out of pocket except those monthly premiums. Now, of course, like with everything else, the devil's in the details. So typically health insurance policies will only count payments made towards in-network services or drugs towards your out-of-pocket maximum. Additionally, we've seen some plans carve out things like the deductible or co-payments out of the out-of-pocket maximum if they're an employer plan. So it's really critical to look at your specific policy. But here's an example of how this all could work. Noah has a plan with an $800 deductible, a $200 copayment for prescription drugs. It's a 70-30 plan, and his out-of-pocket maximum is $1,500. Noah has a prescription for a $10,000 oral chemotherapy drug. What does he pay? Here's how we actually figure it out. First, he has to pay that $200 copayment, which leaves $9,800 left. But then he also has to pay the deductible, which leaves $9,000 left of the original amount. Remember, he has a co-insurance of 30%, which in this case would equal $2,700. But remember, he has that out-of-pocket maximum of $1,500. So Noah only has to pay the $200 copayment, the $800 deductible, and another $500 to get to that $1,500 out-of-pocket maximum. Now, here's where understanding the out-of-pocket maximum becomes particularly important. This is a monthly prescription, and the $10,000 is per month. So what does Noah have to pay for his oral chemotherapy drug next month? And the answer is 0 because he's met his out-of-pocket maximum. Now, I fully admit that this is a simplistic example of how this all could work, but it really shows why understanding the out-of-pocket maximum can be so incredibly valuable. So most health insurance policies have a network of providers and hospitals and pharmacies that they've contracted with to provide services for a set rate. If you go to providers within that network, you're going to be charged that contracted rate. But if you go to a provider out of the network, your insurance policy will not cover the services at as high of a rate, or they may not cover it at all. Now, the amount the insurance company will pay, to reimburse a healthcare service or procedure is the allowed amount or the contracted amount. Some plans may also require that you get a pre-authorization for them to provide coverage, which means that you have to go to the insurance company and ask them if they're going to cover the service or the drug before you receive it. So speaking of prescription drugs, sorry, my slide deck has a mind of its own today. There's a whole set of terms that we need to know specifically about prescription drugs. So when an insurance policy offers coverage for prescription drugs, they have what's called a formulary. The formulary is a list of drugs that the policy has said that it's going to cover, and at what level. Almost always the formulary is going to be broken down into different tiers. And the amount that they're going to pay for coverage is going to depend on where the drug falls into which tier. So for example, here we have a policy that has 5 different tiers: formulary generic, non-formulary generic, formulary brand, non-formulary brand, and specialty. So the amount that the insurance company is going to pay for a non-formulary generic is probably going to be more than what they would pay for a non-formulary brand name drug. So it's important not just to know that a insurance policy is going to cover a prescription drug, but also at what rate they're going to cover that. There are also some insurance companies that require something called step therapy. And step therapy is when an insurance company requires an individual to try one or more medications, usually a generic or a lower cost medication, to treat a specific condition. And if that lower cost drug doesn't work, then the patient is able to step up to another medication that maybe is a little bit more expensive. So even if a plan requires step therapy, there may be ways to avoid it if that is medically appropriate and that a healthcare provider agrees that it's medically appropriate. So if an individual and their doctor believes that a drug is outside of the insurance company's step therapy process and it's the best choice, they may be able to get a prior authorization or an exception request to show that a prescription drug is in fact medically necessary for that patient, and that asking the insurance company to make an exception to their step therapy process. So generally speaking, that's referred to as an exception request. Now, typically, if a prescription drug is not included on the insurance company's formulary, then they're not going to provide coverage. But this is another example of when somebody might be able to use the exception request. And there are several types. So maybe it's about requesting to cover a non-formulary drug. Maybe it's a tier exception. Maybe that would mean the insurance company would cover the drug as if it were in a lower tier. There could also be a brand exception. So some insurance companies will say, we're only going to cover the generic form of this particular drug, but for whatever reason, that patient needs to have the brand name drug. Then a doctor and a patient can actually file an exception request for that as well. And they're all about medical necessity. So that's the key language. And you really have to show in the exception request why someone would need one drug over the other. And so working with the healthcare team is so incredibly important in this process. Now, there's a couple of other terms that are often thrown around, and I've already used them quite a few times even today, but the reality is there's different types of prescription drugs. So starting up here at the top, a brand name drug is going to be the thing that is brought to the market first, and it is named by a specific brand. A generic drug is one that's going to be chemically identical to the brand name drug, but once the patent has run out for a brand name drug, generics can start to be created. And so this is just one example. So Advil is the brand name drug, and Advil's been around for many, many years, and it's now sold in many places as a generic ibuprofen. So you pretty much have exactly the same thing, but the generic version costs a lot less. Now, there's another type of prescription drug called a biosimilar. A biosimilar is a drug that's approved by the Food and Drug Administration, or the FDA, and it's almost an identical copy of the original product, but it's manufactured by a different company, and they're officially approved versions of the original, and they can start to be produced once they're officially approved. So a lot of times there's confusion between generics and biosimilars, but they're not actually the same thing. So a generic is going to be chemically identical to the brand name drug, whereas a biosimilar is only going to be quote unquote highly similar. But with both generics and biosimilars, they're close enough to the original brand name to accomplish the same therapeutic and clinical results. So there's some differences in between a generic and a biosimilar. The other difference is that typically when we're talking about a generic drug, we're talking about copies of a synthetic drug. Whereas when we're talking about a biosimilar, most often we're talking about copies of a drug that uses living organisms as part of its ingredients. So again, there's some differences. It's not just about being identical or not, but it's about the makeup of the drug as well. Now, there are a couple of places where we can get our prescription drugs. So certainly retail pharmacies, and that's what many of us think of when we think about getting our prescription drugs. So if we're talking about a brick and mortar, it's going to be like walking into a Walgreens or the corner pharmacy that's provided inside your grocery store. But many retail pharmacies also provide mail order benefits. That's exactly what it sounds like. So you order your prescriptions and then you receive them in the mail. Now, it's important to understand your insurance coverage and how they're going to treat these different options, because sometimes insurance companies are going to require that if you have an ongoing prescription, for example, one that you're going to be taking for more than 3 months, then they're going to require that you get it through a mail order service to be covered at the highest rates. So for example, blood pressure medication or oral contraceptions might be examples of something that an insurance company would say, if you want it to be covered at the highest rate possible from us, you have to get it through a mail order service. Compared with maybe just an antibiotic that you're going to take for 10 days for a sinus infection that can be picked up at a pharmacy counter that's going to be covered at a higher rate. So it can be a little challenging to navigate because you may actually be getting some prescriptions mail order and some prescriptions brick and mortar, but really valuable to understand your specific coverage. Now, the other type of pharmacy is a specialty pharmacy. And this is kind of a loosely defined term, but generally speaking, the drugs at specialty pharmacies are going to dispense are specialty drugs. So they're more expensive, more complicated. Typically, they're ones that are used to treat rare and complex conditions like autoimmune diseases or HIV or cancer. Sometimes the drugs at specialty pharmacies also have special handling requirements, like they have to be refrigerated. Or what we see a lot happen in the cancer context is that individuals who need additional support. So not only do they dispense the drug, but they can also help with things like prior authorization or financial assistance or more education. So I think specialty pharmacies are a really valuable resource for people who have complex medical conditions and are taking drugs that can be provided by specialty pharmacies. So now that we kind of have the basics around terms related to prescription drugs, we have to talk about the idea that they can be expensive. We've had some amazing advancements in cancer care over the last several decades, but with those advancements has come a higher price tag. I was just doing some quick searching to see where things are right now, and some of the new therapies are costing between $135,000 and $475,000 for an individual. So we're talking about one round of treatment costing $100,000, and most Americans don't even make that much money in a year. So it seems to reason that even individuals who have insurance, whether it's something they've purchased themselves or a plan they've gotten through their employer, once they receive that cancer diagnosis, they're probably going to have to contend with the high cost of prescription drugs. So what can consumers do to get help to deal with those high costs? I would argue that the most important thing we all can do is have the right health insurance plan for us. The challenge with that is many of us are never taught how to choose a health insurance policy. So I'm happy to say that Triage Cancer has several resources to help you do that, including an archived webinar and an animated video specifically on how to choose a plan. But some of the questions you're going to want to look at are, well, what are the costs? What's the coverage? So do I have to go to mail order pharmacies only, or can I do retail? What's the formulary? Does it require step therapy? Is there a separate drug deductible? So do I actually have to meet 2 separate deductibles? And this is not a one-time activity. Assessing our health insurance options is something that needs to be done every single year. And we actually now have an option to do that. So if you have a plan purchased through the state health insurance marketplaces, there's an open enrollment every single year. If you have an employer plan, there's going to be an open enrollment every single year. And every year during that time, we need to be assessing, does the plan still meet my current needs? But also, and this is very important for people who are either still in active cancer treatment or are experiencing late or long-term side effects or are on some sort of maintenance therapy, they need to really be thinking about the year coming. And that's where communicating with your healthcare team can be so incredibly important. So talking with your healthcare team about what types of prescription drugs do you anticipate that I will be taking in the year ahead. Certainly it's not fail-proof. There's going to be sometimes things that come up that we couldn't have predicted, but in many cases, there is a course of treatment. And so providers know, oh, in the next 6 months, you're going to be taking these drugs. And after that, you're going to be taking these drugs. And so looking for a policy now that's going to meet those needs for the next year can save probably hundreds of thousands of dollars in the long run. Now, it may also be necessary for you to be an advocate for yourself. So if you receive a claim denial for coverage of a particular prescription drug, it's important to understand that you have the rights to appeal those denials. And it sounds so easy to say, well, appeal the denial. It is obviously more complicated than that, but it is not impossible. And we know that a minuscule number of all denied claims are ever actually appealed, which is unfortunate because we also know that of the claims that are appealed, somewhere between 40 and 60% of them are decided in favor of the patient. So that means that about half the time, the insurance company is getting it wrong when they're denying a claim. And if people don't avail themselves of the appeals process, they may end up paying more than they need to, or they may end up going without prescription drugs that they really need. So in order to help people navigate the appeals process, we have some resources, including an hour-long webinar on the appeals process. We have a quick guide on appeals, and we also have a health insurance appeals tracking form, which is just a way to help you organize the conversations and the status of the appeal. And all of these can be accessed on our website for free. And the quick guide and the tracking form can be downloaded for free as well. Now, even if somebody has a great health insurance plan, there's still out-of-pocket costs. And for someone who maybe isn't working or has lots of out-of-pocket costs, they may need some assistance actually paying for those costs. So there is a couple of options. The first is using some sort of drug discount card. Now, Triage Cancer has partnered with another organization called Needy Meds, and we have this drug discount card that could offer discounts of up to 80% on certain prescriptions at thousands of pharmacies nationwide. So basically what somebody could do with this card is go to the pharmacy and say, could you tell me how much my prescription drugs would cost me if I used this discount card versus using my insurance? And it may be that the insurance is still better, or it may be that this card doesn't apply, but it starts a conversation between you and the pharmacist about what other options might be available to help you pay for your prescription drugs. Now, what's super interesting about this card is that anyone can use it. There's no income or insurance status requirements. There's no registration process. One person can use the card for the whole family. We actually have copies of these cards. If there are any healthcare providers on the line today, you can request them on our material request form. And then if you have patients struggling with prescription drug costs, give them one of these cards to try at their pharmacy. There are also some financial assistance options, and these programs often will offer low cost or free medicine if you don't have insurance, or if you're underinsured and can't afford your medications. So that could be in a situation where maybe you have insurance that has prescription drug coverage, but you've been put on a very expensive non-formulary brand name drug that has a very high copay. Now, these organizations are varied. Some are based on geography, some are based on the type of cancer, some are based on being a young adult. There are also some private programs that might help, and we've listed some here for you. But just as a reminder, we have a detailed list on cancerfinances.org. So when you go to Cancer Finances, you start the toolkit, you go to the Financial Assistance Resources tab, and then from the drop-down list, you pick prescription drugs as the type of financial assistance you're looking for, and out pops some of the resources that we've culled. Now, resources are changing on a very fast-paced basis, so you'd always have to contact the organization itself to see if you qualify. And unfortunately, there's no standard enrollment process. So each program defines and sets their own qualification standards and their own applications. So it can be a tedious process, but we also know that they are incredibly generous and that many of these organizations have help for people to navigate the application process. So now I want to introduce you to Charlotte. Charlotte was diagnosed with HER2-positive breast cancer last month. She's a small business owner, and since her diagnosis, her income has decreased because she just can't work as much. Her health insurance lists Ibrance as a Tier 5 drug with a $6,000 copayment. Her doctors prescribed a dose of 125 milligrams per day for an initial 21-day cycle. The total cost for that cycle is $21,386. Charlotte's co-insurance just for the first round of treatment is $6,415.80, and her copayment is $6,000 for a total of $12,415.80 that she has to pay out of pocket. Charlotte doesn't have this money and she doesn't know what to do. This is an example where if Charlotte came to us, I would suggest that she investigate if there's a pharmaceutical or specialty pharmacy assistance program. And the very first step to figuring this out is to figure out who makes the drug, who's the manufacturer for the drug. And there's several ways to do that. You can certainly ask the prescribing doctor. There's usually some sort of label on it if you've already received the drug. But even before that, we can go to our trusty tool, Google, and get all sorts of answers. So I typed in half the word and all of these things showed up in Google's suggestions. So it really was not challenging to figure out who made Ibrance. And in this case, it's Pfizer. So after that, now I have to figure out, what does the program do to help people? Does Pfizer have a program? And what are the requirements? Because every program has a different set of requirements. So some are only going to be for individuals who don't have insurance at all. Some are going to be for people like Charlotte who are underinsured, because even with insurance, the cost of the drug is so expensive. Many of them have income guidelines, so you have to have an income under certain thresholds in order to be eligible. But the moral of the story here is that every pharmaceutical company's program is a little bit different, and even within one pharmaceutical company, they may have multiple programs with different requirements, even for the same drug. So now I know that Pfizer makes this drug that Charlotte's taking. So then I just Googled Pfizer Ibrance financial assistance, and I was taken to this very well organized webpage. Now I have to stop here and give a disclaimer. I am not in any way promoting Pfizer or their products. Ibrance just happens to be one of the few drug names I can actually pronounce, and I'm not entirely sure I'm pronouncing it correctly. So just consider this an example and not any sort of endorsement. So as you can see here at the top of this web page, it's broken up into people who are commercially insured, which means someone who has an insurance plan that they purchased directly from an insurance company, or they're offered insurance through an employer. If they have an employer-sponsored plan, it explains that the copay assistance program, and then clicking from here, you get to a super simple enrollment form. Now, if I had Medicare or no insurance, I could click those versions and go through a pretty similar set of tasks to sign up for their program. Now, I fully admit that not all of the programs are this easy to navigate, but many of them are. And this is one of those underutilized resources for accessing financial support to get prescription drugs. So I definitely suggest for people who are struggling to pay for their drugs that they investigate if the manufacturer has any sort of programs. Now, I mentioned Medicare. And for individuals who have Medicare, things are a bit different, as we need to figure out which part of Medicare is going to be covering the drug in question. And here's a very simplistic starting point. So the first question to ask is, okay, well, how or where are the drugs administered? If they're administered or given in an inpatient hospital setting, or a skilled nursing facility, then typically Part A of Medicare is going to cover that prescription drug. If, however, the drug is supplied and administered by a healthcare provider, then typically Part B is going to cover that prescription drug. If instead the drug is obtained at a pharmacy and the patient takes it themselves, then typically it's going to be covered under Part D. So if your head isn't swimming already, hang on, because I said typically for a reason. As I mentioned, that was a really simplistic look, and that's because there's actually a lot of exceptions. So for example, even if a drug is administered inpatient at a skilled nursing facility by a provider, it could actually be covered under Part D instead of Part A if the skilled nursing facility isn't covered by Medicare. So we have to understand even more about the person's situation before we can determine which part it's going to be covered under. Similarly, a vaccine that's supplied and administered by a healthcare provider, we would think would be covered under Part B, but there's an exception for vaccines other than the flu for the flu, for pneumonia, or for hepatitis B. If it's any other type of vaccine, even though it's going to be supplied and administered by a healthcare provider, it's going to be covered under Part D. Similarly, we look at oral chemo. Oral chemotherapy is a pill that the patient obtains at a pharmacy and takes themselves. But if that oral chemo used to only be available as an IV, then it's going to be covered under Part B and not Part D. So I don't want to get too far into the weeds because there are certainly lots of exceptions, but I just wanted to bring this up because when we talk about Medicare and prescription drugs, it's incredibly important for people to understand how Medicare is going to treat that drug and what part it's going to be covered under. You might be asking, well, why is it so important? I have Medicare, it'll be covered. Why does it matter that I know which part it's going to be covered under? Well, it matters because every single part of Medicare has a different cost associated with them. So Medicare Part A is hospital insurance, and it's going to cover hospital care and nursing home care. Now, Medicare Part A does have a deductible and a cost share associated, and it's going to depend on the days that somebody's been inpatient. So the cost of that drug is going to depend on how long somebody's been inpatient. Part B is what most of us think of when we think of health insurance. It's medical insurance. So when you receive outpatient care, receive your doctor or see your doctor, get immunizations, those are what we typically think of as Part B services. Well, with Part B, there's an annual deductible of $198. There's also an 80-20 cost share, which means that if somebody's oral chemotherapy is covered under Part B, they're going to be responsible for 20% of that cost. So if that oral chemo costs $10,000 a month, they're going to be responsible for 20% of that. Now, Part D is Medicare prescription drug coverage. This is the newest part to Medicare, and it's only existed since 2003. Now, with Medicare Part D, even if somebody has coverage, there used to be a gap in that coverage that was referred to as the donut hole. And this is one of those things a lot of people have heard of, but don't necessarily understand exactly how it works. So in order for me to accurately describe the donut hole and where we are right now, we actually have to go back to before the Affordable Care Act was passed or Obamacare. And this is what Medicare Part D looked like. The individual was responsible for their deductible, which at the time was $295 out of pocket. Then once they've paid that, Medicare will kick in and they'll be in the initial coverage phase, during which Medicare pays 75% of the prescription drugs and the patient's responsible for 25%, until the amount of the drug costs reaches $2,700. Then the individual enters the donut hole. While in the donut hole, Medicare pays $0 and the patient pays 100% of their prescription drug costs until the total out-of-pocket drug costs reached $4,350, and then the individual was in the catastrophic drug phase where Medicare paid about 95% and the patient paid 5% or a nominal dollar figure. So that whole time that somebody was in the donut hole, they were responsible for 100% of their drug costs, which you can imagine could be challenging for seniors and individuals on disability who typically have fixed incomes. So thankfully, the ACA or the Affordable Care Act stepped in and did several things to improve Medicare, including reducing that coverage gap. So as of January 1st this year, this is how prescription drug coverage works in Medicare. First, you pay the annual deductible of $435. Then you enter the initial coverage phase, during which Medicare pays 75% and the patient pays 25% of the drug costs. Once the total out-of-pocket costs reach $6,350, then they're in that catastrophic coverage phase where Medicare pays 95% and the patient pays either 5% or a nominal dollar figure. So they've closed that gap, and Medicare will contribute all along the continuum of care once that patient has paid their deductible. So as you can see, it's incredibly important to understand which part the drug is going to be covered under so that you can understand what you as a consumer are going to be responsible paying for. Because if your drug is covered under Part B, you're going to have that 20% coinsurance, as I've mentioned. There's no out-of-pocket maximum with Part B, which means that you're going to be paying 20% of your drug costs every single month, which, as I think I've made the point, can be incredibly expensive. So one option for individuals who have traditional Medicare, which is Parts A and Parts B, is to purchase an additional insurance plan called a Medigap plan or a Medicare supplemental plan. And these are plans that are offered by private insurance companies to help cover those out-of-pocket costs associated with Part A and Part B. What's challenging or confusing about this is that Medigap plans are identified by letters A through N, not to be confused with Medicare Parts A through D. So what's helpful though about these Medigap plans is you can see many of them will pick up the Part B coinsurance amount. So Medigap Plan G, for example, picks up that coinsurance amount. But what I often hear from people is, I'm already paying a Part B premium, I'm already paying a Part D premium, I have deductibles, I have coinsurances, now you want me to buy another plan? This is ridiculous. So let me introduce you to Jimmy. Jimmy's almost 65, he lives in California, and he's weighing his Medicare options. He's about to start chemo that will last for 1 year. He's heard that his IV chemo is covered under Part B with that 80-20 cost share. His drug costs will be $10,000 per month, and he doesn't want an Advantage plan because he spends part of the year in Florida, but he's looking for a Medicare option with the lowest out-of-pocket costs. So option 1 is original Medicare, just Part A and Part B. So he's going to pay that monthly premium times 12 for the 12 months, plus his annual deductible, plus that 20% coinsurance. And when we add all of that up, just for Jimmy's chemotherapy for the year, he's going to pay $25,933 out of pocket. So that's his Part B costs plus the chemo cost share. That's a huge amount of money. So what's the next option? It's original Medicare plus purchasing an additional plan, Medigap Plan G, which we've estimated for him in his area would cost him about $300 a month. They all have different costs. So he still has to pay the Part B monthly premium every single month, so that doesn't change from the example above. And he still has to pay that Part B deductible of $198. He also now has to pay the Medigap premium of $300 a month. So we multiply 300 times 12 to get his annual cost for just the Medigap plan. When we add all of that up, we get to so that's $3,600. But Medigap G picks up that Part B 20% cost share. So with option 2, which is original Medicare plus a Medigap Plan G, his costs are $5,533. So by purchasing an additional plan, he's saving himself over $20,000. Now, of course, there are details with Medigap. So if someone doesn't sign up when they're first eligible for Medicare, they can be charged more, they can be excluded, there can be a 6-month waiting period where they're not going to cover anything related to your pre-existing conditions. But, and we have more information, including a quick guide on Medigap plans. But even if somebody's facing a 6-month pre-existing condition exclusion period, it may still be worth looking at picking up a Medigap plan. So thinking back to Jimmy, his option 1 stays the same, where it's going to cost him $25,933. Option 2, though, is original Medicare plus Medigap G, but it's only going to cover 6 months because of his exclusion period. So even with having to pay 6 months of chemo before the Medigap plan kicks in, he still ends up saving $8,400 for that year. And then that Medigap plan continues with him year after year, and he can never have another exclusion period. So for somebody who's going to be in cancer treatment for an extended period of time, even if they have to face that exclusion period, it may still be valuable, especially if their drugs are being covered under Part B. Now, with Medicare, there are also some options to get help paying for out-of-pocket costs with prescription drugs. Just like with private insurance, there is an appeals process. So if somebody's Medicare claim has been denied, they should avail themselves of the appeals process. There are some charitable foundations that might be helpful. Pharmaceutical companies may have patient assistance programs or help people navigate their various options. Certainly, if they have picked a Part D plan that doesn't cover their prescription drugs, they can always choose a different plan come next open enrollment. And again, that Triage Cancer video we have might be a useful resource on how to pick a plan. For individuals with lower incomes, there is a low income subsidy, also referred to as LIS or extra help, that can help people pay premiums, deductibles, and copays for Part D specifically. And then some states have state pharmaceutical assistance programs. They're not available in every state, but I've provided the link here, and there will be a resource page on our past webinars website page that has all of these links that I've provided today in live links. So don't feel like you have to write all of these down. And I know that I've given an incredibly quick overview of Medicare, but please know we have other resources. We have past webinars recorded. We have 2 different quick guides. And on September 15th, I'll be presenting an hour-long webinar just like this one on understanding Medicare right before the annual open enrollment. Now, with any type of insurance, there are some very practical strategies that we as consumers might want to consider. So sometimes it is worth asking the insurance company, how much would the prescription be if I just paid cash instead of using my insurance? Sometimes, shockingly, it's cheaper just to pay cash. Now, there's some downsides to just paying cash because it's not going to apply to your deductible, or if you're on Medicare, it's not going to get you through the donut hole pre-ACA, but it's worth asking the question. Also, Consumer Reports recently did a pretty big study, and it showed that there was a huge variation from pharmacy to pharmacy in how much drugs cost. So shopping around for the best price is very important. And there are a couple of tools to use to do that. So GoodRx and WeRx are websites where you can just go type in the name of the drug, the dose, the quantity, and it will actually show you a list of prices at various pharmacies in your zip code. And that will help you decide where you're gonna shop. In some cases, maybe you wanna transfer your prescription to another pharmacy. Maybe if you have multiple prescriptions and the prices are different at multiple pharmacies, instead of having to go to 3 pharmacies, maybe you can ask your pharmacy to price match the cheapest price. With all of this, unfortunately, the burden is going to be on us as consumers, but we also know that if you don't ask, you're never going to get an answer. I also think that there's a huge value in negotiating, especially if you're going to an independent pharmacy. And some of the things, again, you can ask for are a price match. Sometimes pharmacies will give you a better deal if you ask for a 3-month supply of a drug instead of going month to month. And if you're not sure what to ask, maybe you just pose the question to the pharmacist. Most of them really want to be as helpful as possible. Now, really, the bottom line with all of this is that financial assistance is something where you have to be creative. You cannot get tunnel vision. If you look through all of the options on cancerfinances.org and you can't find anything to help with prescription drugs, look at the other categories that we have listed there. So can you get utility assistance and then shift the money that you have to pay for your utilities over to your prescription drugs? It sounds so obvious when you're not in the moment, but it can be quite overwhelming and complicated. Now, the last thing I want to talk about today before I'm happy to answer some questions for a few minutes is online fundraisers. So this is things like GoFundMe that have become incredibly popular over the last couple of years. They're very easy to set up, and it really does help sort of enlist the help of your friends and family in this situation that you're in. But I definitely recommend that people think through the ramifications of online fundraisers because they are very public. And so if you haven't thought through disclosure issues extensively, I suggest that you do that before you rush to set up an online fundraiser, because disclosing can have wide-ranging and long-lasting implications. Also, if you are receiving financial assistance or extra help through Medicare, or you're on Medicaid, or you get SSI, those all can be based on your income. And if you receive a large influx of money from an online fundraiser, you might jeopardize those benefits. And so there are some solutions and some strategies that we have listed in our quick guide to crowdfunding. So if you're thinking about an online fundraiser and you're in that situation, I definitely recommend you take a look there. So let me pop over to So, does the example of Jimmy include both medical and prescription coverage? Jimmy's example is just about Part B, because as I set up in the example, Jimmy's IV chemo is covered under Part B. The challenge when something's covered under Part B instead of Part D sometimes is that Part B has a 20% coinsurance and there's no out-of-pocket maximum. So if you have a very expensive monthly drug that's covered under Part B, Medigap is the way to deal with that huge out-of-pocket cost. So for that example, we were just talking about Part D. I have a patient being told he's in the donut hole right now, but I thought the donut hole was gone for 2020. So I did too, and so I would definitely want some clarification about what's going on with him. Perhaps what they're saying is he still hasn't met his deductible, which is why Medicare hasn't kicked in yet, but I would definitely want some more information on that, because as of right now, the donut hole has been closed. Now, I will say that there's currently a court case pending with the Supreme Court about the constitutionality of the ACA. And depending on how the Supreme Court rules, that the ACA could, in fact, go away. I think it would be challenging, but it's possible. And so we would be back to a situation where the donut hole was our reality. Are there services or a nonprofit who can provide one-on-one help with survivors, since it's hard for them to process sometimes with cognitive impairments? So in those situations, I would definitely recommend reaching out to Needy Meds. They are a nonprofit, and they you can call their phone number, and they've got great people on staff that can actually help patients walk through what their options for financial assistance might be. So I think there's several out there, and they are on cancerfinances.org, but Needy Meds is one that we work with closely. So I feel confident in providing them as a resource. Let's see, great questions, everybody. So what's an example of an Advil biosimilar? My understanding, and I am not a scientist, I am a lawyer, so keep that in mind before I give this answer, is that Advil doesn't have a biosimilar. Advil has a generic. And that goes back to the difference between generics and biosimilars, in that typically generics are about chemicals, like it's a chemical duplication, whereas biosimilars are going to be when there's organics used in the makeup of the drug. So not every drug is going to have a generic and a biosimilar. In fact, I don't know that there's any drug that has both, but that would definitely be a question for a scientist. So I'm seeing the chat box pop up. So if you have questions, please make sure you're in the Q&A so that I don't miss any of them. Let's see. So I have Medicare Advantage and I tried to use a discount card for one of my meds and I was told I couldn't use it with Medicare. So that is true. So Medicare is the exception for most discount cards in that they're not going to be available for people who are on Medicare. What are the differences in coverage between the many Part D plans? Do all cover? So when somebody's shopping for Medicare Part D, then it's going to be like shopping for individual insurance. They're going to have to go and look at all of their various options to understand what the different coverage is. But I definitely recommend that people don't just look at the premium, but that they're also looking at the formulary and what's being offered. So with that, I think we've reached time. Oh, we're 2 minutes over. I apologize for that. But I'm going to let Madison tell you a little bit more about the CE requirements for the rest of the day. And then please know that you can always reach out to us at info@triagecancer.org if you have additional questions.
Thank you so much, Monica, for that great presentation. Before we go, I wanted to remind you all of the requirements to receive continuing education credit or contact hours. You must have registered online for today's session. People who are listening in on someone else's computer are not eligible for credit. You also must have attended the entire webinar. No partial credit will be awarded. Anyone watching a recording of this webinar will also not be eligible for credit. Within 1 week of this webinar, complete the evaluation and post-test. You must receive a passing grade on the post-test to be eligible for CE or contact hour. You will be redirected to the survey when the webinar ends, and you will also receive an email following this webinar, which will contain the link to the evaluation and post-test tomorrow. Please note that on the evaluation, it asks for your name and email address. You must include these so that we can certify that you completed the evaluation. That email is the address we will use to mail the certificates. We will be sending out certificates within 4 weeks. For any types of healthcare professionals other than nurses or social workers, we are more than happy to provide a general certificate of attendance. Just make sure to indicate that request on your evaluation. And if you have any questions or experience any problems, email us at info@triagecancer.org. So thank you all for joining us today. We hope that you have found this presentation useful and will continue to stay connected with Triage Cancer.